What if I told you that the number one habit that protects your prostate takes only 30 seconds, and yet almost 90% of men over 60 are doing the exact opposite every single day? Gentlemen, I'm Dr. Carolina, a urologist who has spent more than a decade helping men avoid unnecessary prostate surgery, reduce nighttime symptoms, and regain the confidence and comfort they thought aging had taken away from them. Today, I want to walk you through 5 simple habits that research shows can prevent up to 70% of prostate problems before they even begin. These habits are easy to apply, and the difference they make can be life-changing. By age 70, more than 80% of men develop an enlarged prostate, but here is the part that most people overlook. Men who consistently follow these 5 daily practices experience dramatically fewer symptoms. Same age, same biology, same risks, but completely different outcomes. 5 simple choices create 2 very different futures. I want you to stay with me until the end because the number one habit is something you can start tonight and it makes an immediate difference. Let's talk about the reality first. Your prostate goes through 4 or 5 decades of constant work. It produces fluid for most of your adult life, and during those years it is exposed to inflammation, hormonal fluctuations, reduced circulation, and natural cellular wear and tear. That is why benign prostatic hyperplasia or prostate enlargement affects more than half of men by age 60 and nearly all men by age 70. And when symptoms begin, they can take over your life in ways many men don't expect. Waking up several times a night, struggling with a weak stream, feeling constant urgency, planning your entire day around bathroom access, and avoiding long drives, social events, or travel because you worry about your bladder. These issues drain your confidence and disrupt your daily routine more than most people realize. But here is the hopeful part. This level of suffering is not inevitable. Large nationwide studies, especially from Japan, show that prostate symptoms are deeply influenced by lifestyle habits. When you target the root causes, chronic inflammation, poor circulation, hormonal imbalance, oxidative damage, and mechanical pressure on the gland, you can slow or even reverse the progression of symptoms. One of my patients, 68 years old, used to wake up 6 times every night. He believed this was simply what aging meant. But after 3 months of applying these 5 habits consistently, he reduced those nighttime trips to just 1. He told me, "I finally feel like I got my life back." And that is exactly why I teach these methods. They work. Now let me take you through the first habit, and I want you to really imagine how this can fit into your day. Walking for 30 minutes daily is one of the most powerful ways to protect your prostate, yet most men underestimate it. Walking increases pelvic blood flow, reduces inflammation, improves hormone balance, and helps you maintain a healthy weight, which is one of the biggest predictors of prostate enlargement. A major medical study following thousands of men showed that even small yearly improvements in fitness lowered prostate cancer risk by more than a third. Harvard research found that men who walked consistently had fewer urinary symptoms and better long-term prostate health. And the best part is that walking requires no gym, no equipment, and no complicated instructions. One 30-minute walk or 3 simple 10-minute sessions is enough to create measurable improvement. I had a patient in his late 60s who had been sedentary for years. His symptoms were so severe that he avoided going out unless he absolutely had to. After 8 weeks of regular walking, his nighttime bathroom trips dropped from 5 to 2, and he told me he felt energized for the first time in years. This small commitment made a big difference, and it can do the same for you. Walking is the foundation, and the remaining habits build on it in even more powerful ways. Now that you understand the importance of daily movement, let's talk about the habits that often surprise men the most. The next habit is limiting alcohol to no more than 3 drinks per week, and I want you to take this seriously because even moderate drinking after 60 can silently aggravate prostate symptoms. Many men tell me, "Doctor, I only drink a little," but the truth is that alcohol becomes far more disruptive to the body as you age. It increases inflammation inside the prostate, irritates the bladder, and interferes with healthy hormone balance by lowering testosterone and elevating estrogen. This hormonal shift alone accelerates prostate enlargement, and the irritation it causes makes urgency and nighttime frequency significantly worse. A large study from Japan showed that avoiding excessive drinking was one of the most effective ways to delay or prevent prostate enlargement in older men. The threshold is far lower than most people expect. 3 to 4 drinks for the entire week, not per day, is considered safe. One drink means a standard beer, a small glass of wine, or a single shot of spirits. And spacing them out matters. No more than 2 drinks in a single sitting, and ideally leaving a day or 2 between drinks allows your body to recover. I had a patient who used to drink 4 or 5 drinks every night to relax. His symptoms were terrible. Constant urgency, weak flow, and 6 trips to the bathroom every night. When he reduced his drinking to 3 total drinks per week, his symptoms improved within 4 weeks, and by 8 weeks, his nighttime trips dropped from 6 to 2. He told me he couldn't believe alcohol had been sabotaging him for so long. This simple change can make a dramatic difference. The third habit is one of the most powerful dietary tools we have: eating cooked tomatoes at least 3 times per week. This may sound too simple to be effective, but it is supported by some of the strongest research in prostate health. Tomatoes contain lycopene, an antioxidant that directly protects prostate cells from damage. The key is that lycopene becomes far more absorbable when tomatoes are cooked. Studies show that men who eat cooked tomato products just twice a week have a significantly lower risk of prostate cancer and slower progression of prostate enlargement. You can use tomato sauce, marinara, tomato soup, roasted tomatoes, whatever fits naturally into your meals. Pairing tomatoes with olive oil boosts absorption even more, which is why dishes like pasta with sauce or roasted tomatoes are especially beneficial. One of my patients added tomato-based meals 3 times weekly, along with more vegetables and a handful of pumpkin seeds each day. Within 6 months, his PSA levels dropped from borderline high to normal. His urologist was surprised by the improvement he achieved through diet alone. Tomatoes may seem simple, but they offer real protection. As you make them a regular part of your week, you are directly reducing inflammation and oxidative stress inside your prostate. The next habit is maintaining a healthy weight or losing 10% of your body weight if you are overweight. This might be the most underestimated factor in prostate health. Excess belly fat is not just cosmetic. It produces inflammatory chemicals, disrupts hormones, increases estrogen, lowers testosterone, raises insulin, and accelerates the rate at which the prostate grows. Research shows clear connections between waist size, visceral fat, sedentary behavior, and more aggressive prostate enlargement. The encouraging part is that you don't need extreme dieting or dramatic weight loss. Losing even 10% of your body weight can significantly reduce symptoms and improve long-term prostate outcomes. The most sustainable plan is portion control. Simply reducing each meal by 20 to 25%, using smaller plates, stopping when you feel satisfied instead of stuffed, and focusing on whole foods like vegetables, lean proteins, fruits, whole grains, nuts, and fish can produce steady, healthy weight loss. Pair that with your daily walking, and you create a powerful combination that naturally brings your weight down without stress. I had a 62-year-old patient who weighed 240 pounds with severe symptoms. Over 6 months, he lost 25 pounds through portion control and walking. When he returned for follow-up, his prostate had actually decreased in size, and his symptoms improved dramatically. This habit alone can transform your long-term prostate health. Now we arrive at the most important habit, the one that delivers the fastest relief and the one almost every man over 60 gets wrong without realizing it. Never hold your urine. Respond immediately whenever you feel the urge. This seems small, but it has enormous impact because holding urine places direct pressure on the prostate and the bladder. When the bladder stretches too much, it presses down on the prostate, creating irritation and swelling that worsen symptoms over time. The bladder muscles also weaken from being overstretched, and stagnant urine increases inflammation and the risk of bacteria building up inside the urinary tract. All of this leads to more urgency, weaker stream, more nighttime trips, and long-term damage that could have been avoided. Most men hold their urine during meetings, long drives, errands, or even while watching TV thinking it's harmless. But every delay adds stress to the prostate. Going immediately when you feel the urge removes pressure, protects the tissue, supports healthy bladder function, and prevents chronic irritation. One of my 64-year-old patients had the habit of holding urine during long work hours. His urgency became so severe that it interfered with his daily routine. When he finally began responding to his body's signals right away, his symptoms improved within 6 weeks. He looked at me and said, "I had no idea something so simple could make such a difference." This is why I call it the number one habit. It works instantly, it costs nothing, and it protects your prostate every single day. Once you understand all 5 habits, the next step is putting them into action in a way that feels manageable. Start tonight by responding to every urge immediately. Tomorrow morning, commit to a 30-minute walk and treat it as a daily appointment with yourself. This week, reduce your breakfast portion by about a fifth and use a smaller plate to make it easier. Buy tomato sauce or cooked tomato products and plan at least 3 tomato-based meals. Look honestly at your alcohol consumption and limit it to no more than 3 drinks for the entire week. These steps become even more effective when you track your progress. Write down how many times you wake up to urinate at night during your first week. This gives you a baseline. In weeks 2 through 4, most men notice earlier improvements. By 6 to 8 weeks, many experience a 40 to 60% reduction in symptoms, including fewer nighttime trips, stronger stream, and less urgency. There are also supportive choices that amplify all these benefits. If you smoke, quitting will significantly improve both bladder and prostate health. Managing stress through breathing exercises, light stretching, hobbies, or meditation can also reduce inflammation and ease symptoms. And getting annual prostate screenings starting at age 60 ensures that any changes are detected early, long before medication or surgery becomes necessary. One of my patients followed the system step by step for 6 months. His prostate size stabilized instead of continuing to enlarge, and his symptoms improved by more than 60%. Most importantly, he avoided surgery and regained his ability to travel, sleep through the night, and live without constant fear of urgency. He told me, "These 5 habits gave me my life back." And that is exactly what I want for every man listening. As you move forward, remember this. By age 70, most men will experience prostate enlargement, but enlargement does not have to mean suffering. The habits that protect your prostate are simple, practical, and fully within your control. Walk daily, limit alcohol, eat cooked tomatoes regularly, maintain a healthy weight, and never hold your urine. These small decisions shape your long-term health in powerful ways. Your prostate health is not determined by age alone. It is determined by the choices you make today, tonight, and every day that follows. You have far more control than you might think. And if you begin now, your future self will thank you for it. Gentlemen, I'm Dr. Carolina, reminding you that your health is your greatest asset. Protect your prostate starting tonight and protect your quality of life for the years ahead.